Hello YouTube and Facebook friends. Dr. Kemp here, and today is Monday, November 25th, 2013, and I wanted to do this video to share with you some information since I have come from a procedure that I underwent at the hospital on this past Friday. I had a age 50 colonoscopy, and so I wanted to share with you some information regarding that and that procedure and the importance of doing that. Now, a colonoscopy is a direct visualization of one's colon and rectal system, and a gastroenterologist is the type of doctor that would usually engage in that procedure. They use a colonoscope, which is a lighted camera, and they look inside of your colon to see if there is any abnormalities. They're looking for polyps, if that they could then biopsy to determine if they're malignant or cancerous. They're looking for ballooning or aneurysms in the internal lining of the wall of the colon, and any other abnormalities that might be ongoing in the colon. If there is bleeding, for example, and if there is, then they would be able to repair the damage. It's very important that that a person, especially when you turn 50, men and women, have a colonoscopy for a number of reasons, but especially because there are many people that are dying as a result of colon cancer, colon rectal cancer, and it's a condition that is actually preventable. According to the CDC and other research institutions, colon rectal cancer is actually the second deadliest form of cancer in men and women. African Americans specifically have the highest colon rectal cancer incidence as well as mortality rates of all racial or ethnic groups in the United States. In fact, according to the United States Census Bureau, there are approximately 42 million African Americans living in this country. They comprise approximately 13% of the population, or we comprise approximately 13% of the population. But of that population, approximately 18,000 African American men and women will be diagnosed with colon rectal cancer by the end of this year. And also by that time, by the end of next month, approximately 6,850 African Americans will die as a result of colon rectal cancer. African Americans have a 45% higher chance than European Americans of having colon rectal cancer. So because our incidence rate and our mortality rates are so high, it is imperative that African Americans, as well as other men and women of other racial ethnic groups, have the colonoscopy procedure conducted. I want to share with you personally what I had to go through in order to prepare, because you have to prep for the colonoscopy. My physician told me to prep during a day, to take a day off from work in order to prep, because they give you 2 bottles of medication. This stuff here, it says Suprep Bowel Prep Kit, and it's an oral solution consisting of sodium sulfate, potassium sulfate, and magnesium sulfate. And this bottle contains 6 ounces. And they give you along with these, they give you 2 of these. You get 2 of these in a kit, in a box. And you get a 16-ounce cup, plastic cup. Well, I decided, rather than doing mine in one day, taking off a day, I didn't take off a day like they said the day before going in the hospital. What I did was, I was off on Wednesday anyway, so I took Wednesday and I did my prep on Wednesday, and then after my my classes and working on Thursday, and a meeting on Thursday, I came home and did my second prep in the afternoon on Thursday, and then went into the hospital at 5:45 on Friday morning. But the prep consists of this: pouring this 6-ounce bottle into the 16-ounce cup, and then filling the rest of the cup up with water, and then you drink this. You drink this solution. This is the worst part of the colonoscopy procedure, because this is kind of a greasy type stuff. Now, I've heard that there are other options to this, but and that you have to ask for those options. But since I had never gone through the procedure before, I just took what they gave me and drank this stuff. And so you have to dilute it with the water, and then after you drink that 16 ounces of this with water, you then have to drink 32 more ounces of water within the hour, or within an hour of having drank this solution. And within 15-20 minutes, this prep begins to work on your system, and it begins to clean out your colon, because they need a clean colon to be able to search around inside of your system. They blow air into your colon to expand it, and then they're able to use the colonoscope to search around into the interior walls, looking at the interior walls of your colon. And then I, as I said, I did this on another day, on a second day. Obviously, you're on a liquid diet during the prep time. They allow you to eat some Jello, nothing red, but the more clear type Jello without fruit. You can eat or drink chicken broth. You want to watch your sodium in that chicken broth, because you can buy some of the kinds that's very salt intensive. So you want to be careful about how much salt intake you use with that. But the chicken broth, you can drink juice, apple juice, nothing with pulp in it. Stay away from that. Anything that's solid, you have to stay away from during your prep. So a lot of water, a lot of liquids. No milk products, nothing with milk in it. They allow you to drink coffee, but without cream. Tea, you can drink tea. On the list is also soft drinks, Coca-Cola products and Pepsi and so forth. You can drink that as well. And that's pretty much it. You're limited to juices and soup. You can eat soup, but soup without anything solid. Or you can drink soup without any solids in it. Like I believe I had some vegetable broth. That was very good. I went to a Chinese restaurant, and I bought a pint of the egg drop soup, and my wife screened it for me, or strained it for me, and took out the egg droppings, and that soup. Oh, it was delicious. That tasted better than my chicken broth that I bought from the grocery store. So that was okay. That was good. I enjoyed that. Let's see what else. That's pretty much it. So then you go into the hospital that early that morning, and I went in, as I said, about 5:45 in the morning. I arrived and checked in, showed me insurance card, and they took me back almost immediately to a room, and they began to send people in. Nurses, several, maybe 2 or 3 nurses came in, and they began to ask me my name, and my birth date. So they want to know, they want to make sure that the tag that they're going to put on your wrist, the hospital identification tag, is the same as, corresponds to your name, who you are, and your date of birth, because they don't want to have the wrong name with the person. We've heard of stories of that kind of thing happening. So they validate and cross-validate who you are, your identity, to make sure that you are receiving the proper procedure. They come in, and one nurse will check your blood. And so what I did was I asked the nurse to use my left arm to draw blood, which was that turned out to be a very smart or wise decision on my part, because they use your left arm, your right arm. They use left arm to do the blood. They use your right arm for your IV. Now, when the next nurse came in to do my IV, because they have to put the IV in, they give you the fluids, and they also use that IV to run the anesthetic, because you're going to be put to sleep during the procedure, or prior to the procedure. And so when the nurse came in to put the IV in, she wanted to run it in my forearm, or somewhere in my forearm. Well, I'm not accustomed to having pain in my forearm. I don't take shots in my forearm. But having blood drawn in this area. I mean, that's common. So I asked her to put the needle there. And at first she hesitated and saying, well, you could bend your arm and it could come out. But then she changed her mind. She says, okay, yeah, I can do that. And so she put the needle there and the fold of my arm, and that's where my IV was. And I had no problems with that whatsoever. I have good veins, and she was able to find a vein and put the IV there. And I don't feel any pain. I don't have any problems now. 3 days removed from the procedure. So, but anyway, they put in this IV, and you lay there for a while, and then the anesthesiologist or another doctor came in, and he checked my heart and listened to my lungs. That was a doctor that came in, and then an anesthesiologist came in and introduced himself to me to let me know that he would be the one that would be putting me to sleep. And then my gastroenterologist came in, the doctor that actually performed the procedure came in to let me know that he was getting ready to take care of business. And so within 5 minutes of his coming in, they wheeled me to the OR, and I looked around, and the people that I had just met, the nurses that I'd met, one of the nurses that I met, the gastroenterologist was there, and the gastroenterologist, and then of course the anesthesiologist were there. So there were 3 professionals in the room, and I asked the nurse, I said, what is your job here? And she said, my job is to keep you warm, to keep you comfortable, to make sure that the cover is pulled up on you. So I said, well, make sure that, I said, I get cold easy. I talked to them. I was talking to them in the room, and I said, make sure that while I'm asleep, that you keep me covered up well, because I don't want my arms outside of the cover. Please make sure that you keep my arms under the cover. So that was my request, and she promised that she would do that for me. And then I said, well, what happens now? And the anesthesiologist said, well, he said, you're going to be out in 10 seconds from now. And I thought to myself, I said, no, I'm not either. No. I'd undergone a procedure in the past where I think I had some surgery done on my wrist. So I had undergone anesthesiology, and so I was familiar with how you go under. But I was like, this time I think I'm gonna fight this and see how long I can stay awake. And he said, you're gonna be out in 10 seconds. And so I said, no, I won't. I said that to myself, no, I won't. But then I heard ringing. I heard ringing. My ears just heard ringing. And I said, that's ringing. I hear ringing in my ears. And then, after that, I was gone. I was gone. And the next thing that I knew was I felt a tap. I felt a tap on my forehead. I felt the tap on my forehead, and I opened my eyes, and I wondered, when I felt the tap on my forehead, I wondered, am I in heaven being awakened? Am I being awakened in heaven, or am I still here on earth? That was the thought that went through my mind, and I was at peace. I was at peace either way. I mean, I was at peace. So if I awakened in heaven, I would have been fine. I mean, I was at peace with that. But when I opened my eyes, I saw my little granddaughter, Janessa, and I heard her say, "Papa, uh, what are you doing here?" And then she giggled, and I smiled, and then I saw my wife, Gina, near the foot of my bed, and I asked her, I said something to the effect of, have I gone back yet? Have I gone back for have I gone back for the procedure yet? That's what I was asking her. Have I had the procedure yet? And she responded. She said, "You've had the procedure. You're back." And then I said, then I was happy. I became happy. I felt happy because I'm like, it's over. And I said, I'm back. And she says, yes, you're back. And we just arrived because she had left. She took me to the hospital, and when they rolled me back to the operating room, she left to go and check on the children, the grandchildren, make sure that they were off to school, and to bring our granddaughter back to the hospital. They were here with our youngest son, our 20-year-old son. So he was keeping them. So she went and got our granddaughter and brought her back to the hospital. So they had just arrived, and it was I guess it was about 8:30. It was about 8:30, and the procedure took about 30 minutes in the OR, and so that was about 8:30, and so she said yes. She says, we just walked in the room and Janessa woke you up, and so I knew then that I was there and that I wasn't in heaven and that I was there with my family and here on earth, and that all was well, and I was feeling fine. I was just a little woozy, a little drowsy from the anesthesiology procedure, and then after that, the nurse, and they prep you before you go. They tell you what it is that they're going to be expecting of you before they release you from the hospital. They want you to release some of the air from your colon, so that they know that there's no blockage before you leave. And so they're supposed to come in and they check on you. So they came in and they checked on me, and I said I'm fine, and I'm ready to leave. And so I had to stay there for another in the bed for about 25 minutes or so, and they brought me my paperwork, and they released me. And in fact, I didn't get to see the doctor. I'm supposed to have a follow-up visit in a week or so to talk with the doctor, but I'm fine. And they released me, let me go, told me I can go eat, and so now you can't drive, so you have to have someone there to drive for you. So my wife drove me to Country Kitchen. That's where we went to Country Kitchen, and I ordered a big breakfast, and I enjoyed my breakfast. And then I came back home and went to bed and slept for the remainder of the day. And that's what you do. You just have to sleep. And then I got up on Saturday, around 11 o'clock Saturday morning, and I felt wonderful. I felt great. And so if you look at my Facebook page and you see the little video clip there, I was I don't know, it sort of, to me, sometimes looked like that was an enactment or reenactment, or that I was acting. Hey, that was the real deal. that was because what I did was I asked Gina to record me. I actually asked her to record me while I was asleep. I wanted her to catch me snoozing um, while I was there in the hospital. And so, but what happened was that Janessa, my granddaughter, ran into the room and tapped me on the forehead just as she was beginning to videotape me with her little cell phone, and tapped me. And so everything that you saw on the Facebook page of that little clip of me awakening, that's the real thing. That's how it happened. So you got to hear everything that I said and so forth. And so thank you again for those of you that were praying for me. Um, all is well. If you are 50 years old, male or female, this is a procedure that is highly recommended that you undergo. According to the CDC and other places, if you are African American, they recommend that you have this procedure done when you turn 45. And then, according to the paper that I read, you're supposed to go back in. I'm supposed to go back in every 5 or 6 years. So, and have this done. Now, finally, let me say this. I've known a couple people that have had some serious problems with their colon. We lost one of my aunts a few years ago. She had severe colon problems, and she died. The same day that I was in the hospital, a good friend of mine passed away later that afternoon. That I just gotten out of that I got out of the hospital on Friday, and my understanding from talking to his wife that he had significant, severe colon problems, and he passed away in the hospital, and he was only 50 years old, African American, and so this is a serious situation, and I want to strongly advise and recommend that you, all of my friends on YouTube, even if you're not my friend, if you're my Facebook friend, that you seriously consider having this procedure done, especially if you're in our age, my age category. I'm 54. I waited 4 years. My doctor told me when I turned 50 to have it done, and I put it off until now to have it done. And I'm glad I did it. And since I've had it done, several people on Facebook have contacted me who are younger, in fact, than I am, and informed me that they've had the procedure done as well. So go ahead and have your colonoscopy performed, and hope everything turns out well with you. Dr. Kip here saying, peace out.